Step up.
You may have seen the commercials,
Descovy for PrEP is a once-daily prescription medicine that helps protect against HIV.
but weren't sure what PrEP was all about.
Would PrEP be a good option for me?
LaTanya Wilkins said she never knew PrEP was for people like her, even after she'd had an HIV scare.
I was dating a guy, and while we were dating, he found out that he was living with HIV.
And when you went to get tested, no one talked to you at the time about PrEP?
Nope. At the time, I hadn't even heard of PrEP, period.
Wilkins didn't start taking PrEP until years later.
I thought PrEP was for gay men or trans women. I didn't know that I could take PrEP.
Now she tries to educate others.
Make sure they have the resources to take with them. My conversation would be, girl, you heard about PrEP. And girl, you take some PrEP, that's the added peace of mind.
It's Truvada for PrEP.
The FDA approved PrEP medications in 2012. But more than a decade later, the CDC estimates only about a third of the 1.2 million Americans who could benefit from PrEP medications have been prescribed them. And a closer look reveals a stunning disparity. Among people considered at risk for HIV, 94% of white people are now on PrEP, but less than 13% of black people and less than 15% of women are getting PrEP.
I started Sister Love out of anger and frustration that nothing was happening.
Dazon Dixon Diallo founded a women's health advocacy group in Atlanta some 40 years ago because she saw that black women like Wilkins were being left behind in the fight against HIV.
I know I am HIV possible.
Messaging and advertising about PrEP has only recently been tailored and targeted to black women.
I'm a wife, a mom, I'm polyamorous, and I PrEP.
How many people we get tested for HIV?
Dixon Diallo and her team also stress the need to normalize conversations about sex and HIV and to be what she calls sex positive.
We want to acknowledge that people have sex and that just like anything else that we engage in, there are risks.
Science and education brought about a dramatic decline in the number of new HIV cases in the United States. But a case now before a federal appeals court could limit insurance coverage for PrEP. Some employers argue that they shouldn't have to pay for drugs that, quote, facilitate behaviors contrary to the employer's sincere religious beliefs.
I know it works because I was in a relationship with someone living with HIV and never contracted the virus.
For LaTanya Wilkins, tough choices may lie ahead. The cost of the PrEP medication, clinic visits, and lab tests averages more than $5,000 a year.
If my insurance provider decides, I don't want to cover this anymore, I really don't know what I would do because PrEP costs more than my rent right now. I have a lot of anxiety about that.
We should also point out that Dr. Gounder says people who have unprotected sex, have a partner with HIV, have multiple sexual partners, or have had an STD in the last 6 months are most at risk of contracting HIV.